Dear colleagues, management of nucleus in soft cataracts is not always easy. In this case, I had to change strategies and manage this nucleus. First, I have done hydrodissection, and you can see that the nucleus has prolapsed out of the capsular bag. The equator on the left side has prolapsed out of the capsular bag. I am injecting visco on either side of it, and now I am going to introduce the tip of the phaco handpiece, and now see what happens. As I tried to support the nucleus on the other side, the nucleus went into the capsular bag. However, I tried to hold it with vacuum and prolapse on equator out of the bag, and it didn't happen. And see what happened. I'm shaving the nucleus and I'm creating a pit. So I came out and I want to do some more hydrodissection. I've injected a little bit of hydroxypropyl methyl cellulose. Now I'm doing hydrodissection again, and the nucleus has prolapsed inferiorly. The equator, which is at 6 o'clock, has come out. So what I do is, I thought I'll be able to manage the nucleus. I'll rotate it and it will remain prolapsed. But as soon as I introduce the chopper and try to support it, it goes back into the capsular bag. I'm trying to prolapse this part out of the bag, but I could not. So I have to change strategy now. I'll try mechanical chop in this case. Mechanical chop is bury the tip into the substance of the nucleus and stop using vacuum. Just give some support on the nucleus and chop it. If we use vacuum, then we can't even give the support. And now I have been able to tilt the other portion. Now, why the nucleus was going back again and again into the bag? Because the rhexis was not large enough. Now this is another case. This is a hard nucleus. Nuclear sclerosis is about grade 4. So what I do is I bury the tip, travel through the substance of the nucleus, go near the opposite equator, and then chop. I call this submarine chop. So these harder cataracts are easier than soft cataracts. Phaco power being used in this case is about 70%, flow rate is 45 ml per minute, and vacuum is 450 millimeter of mercury. Harder cataracts are easier to hold and easier to chop. That's it. The nucleus is managed. Now this is another case. This is a white intumescent cataract. First mini rhexis was done, then some cortical lens matter was aspirated, and then the mini rhexis was enlarged to this optimum sized rhexis. Now is the time to introduce the tip of the phaco handpiece. Here it goes. Now this is not a hard nucleus. This is rather a soft nucleus, but I'll be able to hold it. So I hold it, go into the substance, hold it, and then chop it. Rotate the nucleus, hold at another place, and chop. Now this free nuclear fragment free triangular nuclear fragment is emulsified and removed. That's it. One heminucleus has been removed. This is the other heminucleus. It is also held with vacuum and chopped, and ultrasonic energy is applied on the fragment and it is emulsified and removed. That's it. Thank you very much for watching. Hope this video will help you in management of nucleus in different situations.